this afternoon. I'm so proud to have Dr. Greg Hun Gasem. I pronounce right?
Yes,
Or
or Jay. You can call me Jay, it's easier.
thank you, Dr. J. What city you from and what state?
I'm from Florida, Clearwater, Tampa area.
Clearwater, wow. Yeah, he's from Florida. He's going to tell us about his experience, how to maybe any kind of experience that he's going to tell us. Maybe it will help you all to take care of yourself after you finish this course, okay? And how to live in the how to take care of yourself to live or to survive in the United States, okay? First, would you like to tell us all about your a little bit about medical degree here?
I did my medical school at the University of Florida, finished that in 2005. I then continued training in family medicine at University of South Florida in Tampa. After that, I trained also in medical acupuncture, and I did a fellowship in integrative medicine with Dr. Andrew Weil. He's considered the father of integrative medicine in the United States. So I did a fellowship with him in the University of Arizona as well. And right now I work full-time in hospice and palliative medicine. Hospice. So
hospice.
Yeah, hospice.
มีใครไม่รู้จัก hospice คำว่า hospice แปลว่าอะไรไหมคะค่ะ hospice คือคนไข้ที่ป่วยหนักอาจจะเป็นส่วนใหญ่ก็จะเป็น cancer หรือโรคที่ร้ายแรงรักษาไม่ได้นะคะและก็กำลังจะตายหมอจะบอกว่าอีก4เดือนอีก6เดือนหรืออย่างช้าที่สุด1ปีนะคะก็จะถึงวาระแพทย์ที่ดูแลเกี่ยวกับhospice ก็จะไปดูแลเพื่อจะเป็นเราเรียกว่า palliative right and maybe pain medicine to give like a cancer patient or what else you giving them?
Basically, we give any type of medications to help with their pain, nausea, vomiting. We try to give them a better quality of life. And, so there's medications we give that what I do is, as well as I do integrative medicine. So I use acupuncture, I use energy work, I use breathing, guided imagery, things like that to help the patient. Because the patient isn't just about the disease process. You have to consider the mind, the body, the spirit as well. Because if you will never attain health or achieve health without all those three. So if we just focus on the body and the disease, you will not get to optimum health and wellness. So, and that's why หมอเขียวปังหมอเขียว สอนหมอเขียวสอนดีมาก so
other than the medication or what do you think like something that you get from Mo Kiel to help them or to maybe treat a little bit like maybe some herbs, some food or anything that you've been practicing right now? Would you tell us?
So one of the most important things, and Mo Kiel says a lot of this, is he focuses on food as one of the big parts of health. In my practice, I've seen over the last 5 years, I've worked in hospice, so I see all the end-stage diseases of cancer, heart disease, Alzheimer's, dementia, multiple sclerosis, diabetes, kidney failure. You name any disease that's at the end, I've seen all of that. One of the things for myself that I've seen is that a lot of our diseases can be helped and prevented using food and lifestyle. Okay, so I started myself back in January, said, you know what, I have to do better for myself or I'm going to end up like all my patients. Okay, so it's important to listen. The nutrition aspect is very important. In the United States, the hard part is that we have a lot of fast food. Okay, we have a lot of fried foods. We don't eat fruits and vegetables. Okay, a lot of the foods we have in the grocery stores are all processed foods. Okay, it's not real food. Okay, our bodies need real food. It kind of makes sense because think about it this way. Think about your body as a car. If you're giving it bad fuel, it's not going to perform well. If you don't maintain it, it's not going to perform optimally. So same thing with your body. If you give your body bad food, where is it going to get the raw materials and the nutrients to fuel your cells? Okay, so that just makes common sense. All right, so nutrition is very important, and I'm seeing that for myself as well. So back in January, I said, you know what? I'm going to eat a whole food, plant-based way of eating. So most of my diet now is about 90% vegetarian at this point. Okay, so I lost about probably 33 pounds since that time. You feel better, and I look at the patients, and I have a clinic as well for hospice patients where I do all this integrative medicine. And I say to them, some of them, I said, well, food's important. But the problem is when I went through medical school, we did not learn a lot about nutrition. Okay, the only nutrition that we learned was through TPN. Basically, you're feeding patients through a tube. That's the nutrition that we learned. We did not learn correct nutrition. Okay, what we hear from the other doctors in training is that go ahead and eat what you want, just be healthy. But that's hard. We don't know what to do with that. So having someone come and tell you, hey, this is the way you're supposed to eat, this is going to help you get better, you want to listen to that, okay? Because I've seen again, like I said, I've seen the end stage of everything. I think about 80 to 85% of chronic diseases in this country can be cured by eating and lifestyle alone, okay? That's a big number. Look at all the diabetes that we see out there. I did a study on myself about 3 years ago. I drew my lab work, and then for 6 weeks, I ate a vegetarian, whole food, plant-based way of eating. I lost 15 pounds without trying. My hemoglobin A1C, that's the marker, the test for diabetes, it was initially 5.7. That's the pre-diabetic range. And I looked at myself, I'm like, wow, I'm in the pre-diabetic range already. That was scary. So for 6 weeks, I ate that way. And after 6 weeks, I redrew my blood work, and it went down to 5.4. That's normal range for your hemoglobin A1C. So you can cure type 2 diabetes just by eating, okay? And again, I think a lot of diseases that we have in this country, a lot of it can be due to your food and what you eat and your lifestyle.
Is suppose the only thing that you think it will help us that sit here, anything else like soul or mind or anything?
Yeah, food is a big aspect, but the other pieces that you have to remember is too the mind, body, and the spirit, okay? Because if we don't believe in those things, it doesn't matter because they're going to be affected regardless if we believe in that or not. Because the point of being a human, we have all those parts of us. So if we only take care of the physical aspect, the mind plays a huge part in our health and wellness as well. So daily meditation practice, Tai Chi, Qigong, yoga, breath work, meaning breathing exercises, those are all important in being healthy. Now, when I say that, you see a lot of people go to the gym, they lift weights to get really big and strong. Yeah, that's okay, but the real thing that helps you is going to be the yoga, the Tai Chi, the Qigong, the breathing, the meditation. Those are the type of exercises that are going to be more healthful, leading towards health. Okay, because we can go into the details, but there's a lot of details on that part. But just remember that you can do that, but you have to do all these other things as well, and the eating.
Pretend that I'm your patient. Nayang is your patient. I don't believe you, Dr. J. You're telling me about eating right? I mean, healthy food. How can I eat it? It's no taste, ไม่อร่อย What do you think of Is Nayang don't follow you or whatever you said?
Good question. I have a lot of patients of mine that ask me the same question. They say, why do we have to change? And I say to them, you know, I've been working in hospice for 5 years. I've seen what's going to happen to you if you continue to live the lifestyle that you live now, okay? And if you continue living the lifestyle that you live now, you're going to be one of my patients soon, and we'll take care of you. You know?
Okay, good. Up until now, what do you think you understand what he's talking about? The one who want him to speak Thai? You okay? You okay? Understand, right? He tried to tell us about he think the food is the most important, and it's your mind. Who control your body is the super on top of whatever order, whatever you are going get your hands and put in your mouth, something like that, which is good, right? Thing, okay. The integrate between our body and mind. What else you think that can help the audience here to take care of themselves, especially in the United States?
You know, one of the things is the problem is we have a lot of convenience foods and we don't have a lot of time. You know, when you're working, you're very stressed out. You know, sometimes you don't have time to sit down and eat lunch or dinner. So one of the important things to do is try to slow down a little bit, because it is important, like I said before, is that stress plays a big part in health as well. Okay, if you're stressed, เครียดมาก you're not gonna have your body's not gonna function well. You know, if you're having a lot of stress, one of the first thing that goes is your GI system, your stomach. You start feeling nauseated, you feel like you have to vomit. Sometimes you might not go to the bathroom well. So stress affects the GI system a lot. Okay, so the thing to keep in mind is that, like I said, food is an important piece, very important piece, but it's not the whole piece. We can eat as clean as we want and as good as we want, but if we don't nourish the mind, you're not going to attain optimal health, like I said before. So the mind is a huge part. Think about this. People talk about placebo a lot, right? You know what placebo is? Okay. So the placebo, that's the mind playing a big part of the body. Real quick on one study, I read a study a few months ago. They took let's say a drink, a shake. They said it had 300 calories in it, okay? And they took 3 groups of people. One group, they said, hey, we're going to take a 600 calorie shake. And the other group will take a 100 calorie shake. And another group will take a 300 calorie shake. None of them knew that all the shakes really were 300 calories. So guess what? The group that was told that they had 600 calories gained weight. The group that was told that they had 100 calories lost weight. So the mind plays a big part in all these things. You know, I remember one time in medical school, I took a ride on an ambulance and went out to a call. The patient was very anxious. And the paramedic was like, okay, we're going to give you some normoxidine, okay? And this is going to help calm you down and get you feeling better. So he pretended like he was pushing normoxidine. And the patient immediately felt better. Say, oh, I feel so good. But it was normal saline. Basically, it's salt water that we were telling the patient we were giving her. So the mind plays a big part in our health. So you can't neglect that. So you have to put all those pieces together. The mind, the body, and the spirit have to be balanced in order for us to achieve good health.
Thank you, Dr. J. I've heard that you've been attended Hmọ Kheo's camp, the health club in Los Angeles, last 2 years. You know about 9 pills from หมอเขียว right can you tell us what are they what are the 9 pills from หมอเขียว a little bit
I can't remember them all, but
okay I'm going to tell you who has the 9 pills on your back of the church please show me now who is going to standing up คุณหลินมีใครมีเสื้อ come here in front of me on the stage okay คุณหลิน come can you read Thai
ช้ามากครับ
The first one is about healthy food, okay? For the balancing of your body, about heat and cold. Number 2 is gosa. You know gosa?
Yes, so I do. So the food we already talked about, we know that's important. The heat and cold property helps balance out the body. So if you're having one in excess, like a lot of heat when you're eating a lot of peppers, then you're going to have reactions. If we have time, back when I was in LA 2 years ago, when I went to Hmao Kiel's camp, it was me and my mom and my sister who went there to LA, and we stopped by a restaurant, and I got it was like fried tofu, okay? And I ordered it in mild, but it was really, really, really hot. So my mom and sister were like, hey, you can eat it because it's too hot for us. So I ate the rest of the bag. And no kidding, that night I had diarrhea, I had a fever, I felt horrible through the morning. So that next morning, the course was going to start. And I felt really, really bad. I was in the bathroom the whole night. And my mom, when we came to register, she was like, hey, can someone help my son? He's, something happened to him. So that's when I started doing the detox for the first time. They did gua sha for the first time on me. We used the cold property liquid to put in my ears. They were scraping my scalp and things. And you know what? It helped. I felt better. The course of the day, I started feeling better and better, and by the end of the day, I felt good, and I was able to participate in the rest of the course. So.
อันนี้ดีกว่าโอ้ยคนยืนเลย
Okay, the third pills is detox or enema. You have done that.
The first time my mom was telling me, hey, you need to do an enema. I was like, Mom, you're crazy, because why would I do an enema? So when the first time I did the enema on myself was when I went to Hmao Kiel and I had the problem with the diarrhea and the fever and things like that. And he's like, hey, you really need to do this because they put the yanang, I believe, they put into the enema bag. And I did the detox, and it was a cooling property because I had too much heat because of the hot peppers that I ate the night before. So after getting the cool property detox, then it was able to balance out the rest of my body's system there. So it was very helpful. I can tell you almost immediately it felt good. So sounds weird, but it felt good to do an enema.
You still practicing the detox right now? Not very much?
I haven't done it in the last few months. When I used to do the liver flush, I did it a lot. So.
Oh, good. Okay. At least you know how to do it, or you did, or you have done already. Okay. Number 5 is about soaking your feet and your hands in the warm water. Number 5. I saw some of. Please come in front about your doing คนที่พอกทาอยู่อะค่ะขอเชิญข้างหน้าหน่อยพอกทาด้วยcharcoal and clay okay this is how we try to get rid of the toxin one of the kind and is number 4 number 5 have you done this before
Yes, I have. It works very well, actually. What's that?
Work very well with what?
Oh, well, it works well if you have to do all of the 9 pills, but it helps. It helps again. It helps with detoxing the skin. One of the things in Chinese medicine is that they say the skin is an extension of the lung, right? So the skin is actually a breathable part, so you can compare it to the lung tissue as well, because we have pores and we can exchange a lot of nutrients that way. We got sweat, and then you can put patches on and we can absorb things as well from that standpoint. So detoxing through the skin is another way of getting your body rid of toxins. So when you start eating this way, sometimes people react and respond differently. They might get some rashes and things of that nature, but it's the body's way of detoxing as well. So.
Oh, okay. Thank you, both of you. Okay, we can talk in details later, or the คุณลิน and คุณนิดหน่อยก็จะมาพูดเรื่องเกี่ยวกับยา9 เม็ดในรายละเอียดนะคะ Number 6 is exercise yoga. I'm sorry that the first one is the herbs, the chlorophyll. I messed up with number 7, the healthy food. So I'm sorry. Number 1 is the chlorophyll, or the herbs that we extract the green stuff from the herbs. And number 7 now is that what he mentioned, and pay attention more about food, especially in United States. And number 8 and number 9 is what หมอเขียว is teaching us about Dhamma that he been very good in teaching us, and everybody satisfied, and you like the way he's teaching right now, that control everything about our ความเจ็บไข้ทั้งหลายนะคะจิตวิญญาณเป็นผู้ที่จะบงการทั้งหมดเกี่ยวกับความเจ็บไข้ทั้งหลาย Dr. J he said about the soul, the mind. He been talking about this. I know that you've been practicing meditation, okay, and your family too, okay. What you think you get it from your meditation? You want to tell us?
Yeah, my mom's since I was little, she would always force us to meditate. Okay, and so growing up, I learned a lot about meditation. Took different type of courses. So we used to meditate an hour in the morning, an hour in the evening, and that was very helpful. And then I also went to Vipassana meditation courses in the United States as well. Did 3 10-day courses with that. So those courses are very good. They really gets you to know about yourself, your deep inner self. So those are important things to do. So the meditative part is important. When you start working, your schedule gets busier. But recently, I've been trying to get up earlier in the morning to at least do 15-20 minutes of meditation. Any little bit counts and is helpful. The important part is to try to do it. Even if it's for 5 minutes, you have that 5 minutes to sit there and focus your mind. It's going to be helpful and go a long way in overall health.
Thank you, Dr. J. I thought I never seen this kind of family that teach the son who is growing here in the United States, American doctor. He growing up here. You all have teach your kids about like this? No? Yes? Yes, you do. Okay, I appreciate that family, or the father and mom that, oh my goodness, I try myself. I have 2 daughters here growing up in the United States too. I wish I can make my daughter or son being a good people, being a good doctor like him. So right now I would like they come as a family. The father and the mother of Dr. J, would you please stand up and show คุณพันธวัฒน์และคุณพ่อพันธวัฒน์และคุณแม่ เดี๋ยวชื่อจริงล่วงพรนะคะขอบพระคุณอย่างสูงที่สามารถพูดชาวบ้านก็คือผลิตลูกชายได้ดีขนาดนี้นะคะขอบพระคุณคุณพ่อคุณแม่ทั้งสองและเอาเวลาก็ล่วงเลยมาสมควรก็ขอบคุณดร. J again and we talk to you later or ขอถามหมอโอเค
Can I ask Dr. J as you have said you never learn this the thing that you learn from หมอเขียว you apply to your practice because you haven't learned from your medical school. Did you get this idea from หมอเขียว or you learn from somewhere else?
So I've always been interested. The question was, the way I practice and what Hmol Kiel is teaching us, when you incorporate it into your patient practice, did I learn it from him or did I have it before as well? So I was always interested in things outside of conventional medicine. I went to massage therapy school prior to medical school, so I was also licensed in the state of Florida, and I went to Wat Po in Thailand afterwards and got trained over there as well. So there was a lot of things that kind of pushed me into this direction because after you practice medicine for a while, you look at it and you say, are we actually helping the patients? Okay, that's what you ask yourself. Medications are important in certain instances, but for long-term health, giving a pill out, I don't think is going to be good long-term because you're band-aiding the problem. Okay, so after seeing all this being done, I kind of stood back and said, what can we really do to help people? And this is what you guys are all learning during this week is going to be helping you towards health and wellness optimally, the right way to do it. Like I said, that's why I've practiced integrative medicine. I used the conventional medicine that I've learned in medical school as well as all these other practices. You can blend it into one, okay? Because all of it's going to be helpful. So, you don't want to neglect one or the other because all of them are important. But for long-term chronic diseases, you should go back to food, okay? Because food is medicine, and we forget to think about that.
Thank you, Dr. J again. And what he said, อาหารเป็นหนึ่งในโลกอย่างที่หมอเขียวพูดนะคะ and he agree. You agree that food is the most important to take care of ourselves to live long, right? So you think the medical school right now, the curriculum is good? Last question.
Yeah, so this is what I'm seeing now, and I'm hopeful, okay? Because Dr. Andrew Weil has done a great job trying to bring more of an integrative approach into the mainstream medicine now. Nutrition is starting to become more prevalent in medical schools and residency training programs for physicians. So as the years go on, you're going to see more and more people start talking about nutrition more, understanding right nutrition a little bit more. It's going to be a slow process, it's going to be a long process, but it started. So I'm very hopeful that we're going to be sending the right messages out as well. So because this is the right way to do it. So.
Okay, thanks a lot, and I hope that I can talk to you more and see you again.